Hello. We are going to be discussing cyber threat actors and how they negatively impact the healthcare system. So, just to do a quick briefing and a review on our C suite findings, we discussed how cybersecurity affects the safety and finances of an establishment, and we discussed how threat actors differ due to their motivation, capabilities, and risk tolerance. Today, we're going to be discussing how hospitals are the highest targets due to them having so much information, whether it be financial information, patient information, or even research data. And we're going to be discussing the five threat actors and ways that they can negatively impact the hospital. Before we begin, I want to discuss what a risk is. Because once an establishment can understand what a risk is, there's a better way to minimize the risk and possibly eliminate the risks completely. So, first, you have a threat. A threat is a person or a group of people that are going to cause harm to an establishment's information system, whether it be cyber criminals or insider employees. So, you have the threat, then you combine it with a vulnerability. The vulnerability being the weakness in the hospital's networking system. Once you have the threat and the vulnerability, you combine those two and you get a risk. So, for example, I gave cyber criminals being the threat, a risk being an unpatched EHR server, well, that being the vulnerability, I apologize. And when you combine those two, you get the risk, which would be the data breach. Again, threats find these vulnerabilities, and once they find these weaknesses, that then creates a threat for an establishment. Our top threats would be cyber criminals and insider threats. Insider threats, in my eyes, being the top because they either currently have access or once had access to the information and know how to get access again. Whether compared to everyone else, they're trying to find ways to get access. So, some examples of least serious threats for cyber criminals would be credential phishing or targeting hospital billing staff, while a most serious threat would be ransomware attack on electronic health records. Um, a least serious threat for an insider would be unauthorized access to patient portals or records, while a more severe threat would be the theft and sale of proprietary hospital data prior to being terminated or resigning. And this can impact the hospital and a patient financially through HIPAA violations, through patient care disruption, and most importantly, through patient and hospital reputation damage. Our next threats would be advanced persistent threats, or APTs, and industrial espionage actors. Um, the least serious threat that an APT can cause would be long term covert exploration of hospital networks, while their most serious threat could be exploration of medical research or healthcare information. The least serious threat for industrial espionage would be social engineering of research staff to get vital information, while their most serious threat would be theft of pharmaceutical or healthcare data for competitive reasons and to gain competitive advantage. And these can cause potential impacts on loss of intellectual property, that data, that research, national security concerns, and competitive data disadvantages. Our final threat would be hacktivists. Hacktivists, least serious threat could be hospital defacement of, defacing a hospital's website for a political or social cause. But a more serious threat would be public disclosure of sensitive data, hospital data, patient data to support political or social causes. Again, all of these threats have the potential to impact hospitals and patients negatively through financial losses, important information being exploited, as well as reputation damage. Excuse me. So, some key takeaways we want to remember our top three greatest risks, which would be APTs, insider threats, and cyber criminals. And then, as an executive, some recommendations to stay ahead of the threats would be setting up those two-step authenticator factors across all of your networking systems, or even providing extensive training for the staff. If you're able to identify a threat and a vulnerability, then you have an increased chance of having minimal threats. So again, just be aware of the situation and be understanding and comprehensive and up to date on the threats and ways that they can attack the system and how to prevent these attacks. Thank you.